I'm Dr. Swati Naik and welcome on MQR AICUG TV. I'm highly privileged to have with me President Foxy, Dr. Jaideep Malhotra. Thank you so much, ma'am, for joining on MQR AICUG TV. First of all, at the outset, let me congratulate you on behalf of MQR for being a president of Foxy. And we are looking forward for a wonderful, fantastic year 2018-19.
Thank you.
Madam, would you like to share with us your theme and your plans for the next year?
Yes, Swati. Thank you very much, first of all, and thanks to everyone for putting me in this position. I'm highly obliged to each and everyone. My thoughts for this year, basically, as you know, that Foxy is only all about women's health, and they are also directed towards that, and the theme is give her wings and let her soar, pankh aur parwaaz do, nari ko aakash do, because I feel that women actually play the most important and a pivotal role not only in the family but also in the health of the nation. So looking after her health, empowering her, respecting her is the only way to take her and the nation to the top.
Absolutely.
So that is what our theme is.
Yeah. So she makes a difference and she
Yeah.
is important.
Yeah.
And this theme of her also goes in line with
Yeah.
what our government also has a theme,
Yeah.
that is women's health is a nation's
And
health.
another
Yeah.
very important aspect of my theme is that this her is for the women of the country, and I have another aspect which is for the fraternity, which is QED, quality, ethics and dignity. And I feel that there's no better way of serving our organization and our fraternity and having an impact on the general population unless and until we add quality to our services. Like when you're providing care, if you're providing quality care, the impacts are totally different. And ethical service is also very, very important for the patient-doctor relationship, and dignity of the doctors is also very important.
Absolutely.
So these are the two aspects of the theme which we have and which we are going to work on this year.
Absolutely. The quality of the medical care for
Yes.
a betterment of our society and the patient is highly important.
Yeah.
Ma'am, would you like to share with us some of the initiatives that you have thought for
Yeah.
the year?
Actually, there are many initiatives which we are looking at, focusing on the patients, education and awareness, and also bringing upgradation and constant updating of our doctors. So they're very, very unique. The first program which I'm very, very happy to announce is Adbhut Matratva. Now this program is all about making motherhood a very unique and incredible experience for the patients, and also this is going to sort of encourage the doctors towards engaging with their patients more, because antenatal care is not all about prescription writing. We get almost 1 year with the patient, right from pre-pregnant stage to 9 months of pregnancy, and also about 1.5 months later in the postpartum period. And that's a huge amount of time where you could actually educate the women, empower her, sort of initiate a lot of other health initiatives which she can take, and along with that address many other issues, let's say about women's domestic violence or spacing between the children. So there are lots of things which you could do, and this is a very unique module which starts with preconception counseling. Then in the antenatal period, it actually looks after all the aspects of pregnancy, starting from first trimester, what should be done, what should you expect, how many visits you should actually dedicate towards your antenatal period, and how many times you should go to the doctor, what immunization is required, what kind of diet in the first trimester, then modification in the second trimester and third trimester, and what exercise has to be done, little bit of yoga and meditation, which is very important, because we are today treating pregnancy with a lot of fear factor, and all our younger population, there's a big fear factor which is there. How will I deliver? There's too much pain happening, which is a very natural phenomena. When you have pain, you forget it the next day when the baby is in your arms. And then this time again, once you've engaged, how many ultrasound scans are really important?
Absolutely.
What other investigations are very important? So all that will be put has been put into a module where we are training the doctors on how to actually effectively and efficiently deliver that to their patients, what education should be there, what music to listen to. It's based on Garj Sanskar basically. And once the patient delivers, after that, initiating breastfeeding is very important. We did a survey and we found out that only about 30% of the doctors, basically early initiation of breastfeeding is there, and that's very important aspect. So we have joined hands with the Breastfeeding Promotion Network of India, and we've also joined hands with the PSI. PSI will take care of the contraception post delivery, because again, spacing between the children and also planning your family well is very important. So this is really, I feel it's a unique program which will engage the patient well with the doctor, educate the patient, also basically make her more confident about her pregnancy and delivery. Which is, and once she delivers, and in the long run, it has unbelievable parameters which can be looked into. Not only promoting vaginal delivery is one aspect. The other aspect is fetal origin of adult diseases, because if the nutrition is right, if the insults in utero are taken care of, then all the diseases, the non-communicable diseases, which is a huge thing which is coming up now in our understanding, are taken care of.
Absolutely.
Because we can attribute our diabetes, hypertension, prematurity and many other things to in utero insults.
Absolutely.
And the neuropsychology of the child again is important. Why a certain child behaves in a certain manner, why some babies cry too much, why some babies are more irritable, and why some babies are very calm, all is decided in utero. So we are trying to inculcate that sense, that remain as calm as possible, look after your health as much as possible, eat the right things, take the immunization on time, go to the doctor on time, try to deliver vaginally, try to space your children well, and also breastfeed them to the extent as much as possible. Will take care of a lot of issues in the future to come. So the motto is building healthy future generations.
Absolutely, that sounds really phenomenal. I think the
Yeah.
two very important concepts coming up is the Adbhut Matrutva.
Yeah.
I mean, which was, I think, untapped till today. And I also listened to Brahma Kumari Shivani ji's lecture
Yeah.
yesterday morning, and it was really, really
Yeah.
very good.
So
And
they are associated with us,
Yeah.
and wherever we will do these programs, even in any hospital or anywhere, the Sisters of Brahma Kumari Foundation will come and manage the meditation part of
that's really
pregnant
nice.
women.
That's really nice.
So that
yeah.
is the kind of support they have actually promised us. And Sister Shivani was herself here to launch the program, which is a big unique,
unique thing.
I'm very,
I think
very
she's
thankful
given a
to
very
her.
good message that if we are happy, then our patients
Yes.
are happy.
Yes.
If the patient who is a mother, she
Yeah.
is happy, then the baby
Yeah.
is going to be happy. And then we are not going to face any neurodevelopmental issues in the child. And yes, I agree with you that we see a lot of attention deficit
Absolutely.
disorders in the young in the
Yes.
infants and all. So I
Yeah.
think we can trap that and arrest that right at the in
Absolutely.
utero position.
Absolutely. And another second important program which we have taken up, we are running a program called Manyata. Manyata is all about accreditation of the hospitals and trying to teach and inculcate the right kind of evidence-based practices which will impact the maternal and the neonatal outcome. Now, when we talk about all these things, we have to also understand that most of our hospitals are not accredited. And once they are not accredited, the right kind of evidence-based practices are not there. There are not many protocols in place. There are not good practice guidelines which are in place. So we are trying now that we've decided on 16 criterias which any hospital will follow. And it's following for the doctors is not very difficult. But making the paramedical staff follow all those things is the most difficult thing. And no doctor can deliver unless and until the support system is in place. So we're training the paramedical staff, and that's again a huge project which is there with Merck for Mothers and Japaigo on training the paramedical staff. And this is like, you know, we are identifying the nurses in the hospitals, and we right now run a 3-day training program, but we are going to extend it to about 2 weeks now, where the paramedical staff knows what they have to look into, identify the complications as soon as possible, so that in case if any referral is required for that particular patient, if they are working in a, let's say, a tier 3 city or in a rural area, so then shifting the transfer or transferring the patient should happen at the right time. Patient should not be transferred when the patient is already in, you know, irreversible shock, and so that again is a very important program which we are doing for the federation and the fraternity. And the third very important aspect which we have taken up is that our documentation and our data is not there at all, and most of the times the doctors are working in such circumstances where they're so much busy with their practice and, you know, serving people, that they don't have time to document.
Thank you so much for joining all those plans, and I think a lot to come for maternal and fetal health, and we are looking forward for all those projects getting started. Thank you so much. At the same time, I would also like to congratulate. I just spoke to Dr. Narendra Malhotra sir, and I must say that you and sir is the only couple in the world who holds that president's post of the FOXI. So congratulations on that, as well as being a couple as an honorary FRCOG. Yeah, thank you so much for joining us on MQR ASCOG.
Thank you.
Thank you.